We turn our attention now to yet another COVID conundrum. A year into the pandemic, and doctors are diagnosing more and more patients who still suffer symptoms many months after contracting the virus with having PACS, that is post-acute COVID syndrome, once known as the long haulers. And what's happening to these patients is frightening, and researchers still have very, very few answers.
I could not maintain my oxygen levels. I could barely stand. I was struggling to stay conscious. It was terrifying, to be honest.
New Jersey Associate English Professor Ann Wallace is describing some of what she experienced after contracting COVID last March. Now, 1 year later, Ann still suffers with nearly 100 symptoms at different times in different combinations. And while her oxygen levels are better, some of her symptoms often include shortness of breath, an elevated heart rate, and body functions that should be automatic but aren't.
I have dysautonomia. Dysautonomia is a dysfunction of your autonomic nervous system, the things that we just take for granted. I should be able to walk up the stairs, and yet I can't.
Dr. Ronnie Kondos runs the post-COVID clinic at NYU and describes which patients fall into the PACS category.
It really includes anyone that has symptoms for more than 3 to 4 weeks after acute COVID infection.
Dr. Kondos says although rare, asymptomatic patients can also suffer long-term effects of the virus. It's also true for patients who only had mild symptoms initially.
We expected that the patients that we would be dealing with the most would be the ones who were in the ICU. What we've learned, however, is there are a lot of other patients that did not have severe COVID. They're still very debilitated in terms of their ability to do what they used to do before, in terms of feelings of fatigue, in terms of depression, mental fog. There's a whole slew of symptoms that they're still exhibiting.
Carla Monteroso is the CEO of a nonprofit we met last year when she was first labeled a COVID long hauler. After her initial symptoms of dry cough, fever, and pneumonia subsided, Carla experienced ongoing inflammation, heart palpitations, constant fatigue, and says COVID ruined her gallbladder. Now, 1 year later,
I had a gallbladder surgery in October, and that was actually the beginning of things feeling a bit better. I still get fatigue if I overexert myself, but there is a much larger threshold. I'm still actually tachycardic. I manage my heart rate with beta blockers now.
Carla and Ann still battle some cognitive issues, and both have taken time away from work. But these once extremely active women continue their fight. Carla is part of an NIH study and does physical therapy to retrain her autonomic nervous system. And all three women see vaccinations as the light at the end of the COVID tunnel.
This is a safe vaccine, and it is the only thing that's going to ensure that we're able to get on the other side of this pandemic.
If we have patience and we do the work, I think there is a great deal of hope.
I'm just so grateful that we're moving in the direction that we're moving.
Doctors are reporting that some patients with post-acute COVID syndrome are experiencing improvement after receiving their COVID vaccinations. But they stress they're just beginning to study the effects of the vaccine on people with PACS symptoms. Now, there are several online support groups for COVID-19 survivors experiencing the ongoing issues, including Survivor Core and Body Politic. So check it out.